So, somewhere in China, a coronavirus named Severe Acute Respiratory Syndrome, SARS-2, caused what's called COVID-19 disease. There are two conspiracy theories. One conspiracy theory states that this disease was started in Wuhan in a meat market by bats. The second conspiracy theory stated that this was started in a lab in China. Regardless of the theory, we did find that the coronavirus entry to the United States happened multiple ways through its mode of transmission of human spreading by direct or indirect respiratory droplets. We watched and witnessed the spreading of the initial outbreak in Washington. This was a man traveling back from China. But then, not too much longer afterwards, we saw where an entire nursing home was affected. And we felt very sad and heartbroken when we saw the elderly dying. We learned the virus spread through cruise ships, community spread through California. At one point, New York was the epicenter, and the whole world was watching. The spread to New York happened through European contact. The Houston Livestock Show and Rodeo was canceled because of community spread in Houston. Many of us lost family members and friends from COVID-19. We were not able to say goodbye or funeralize them because of COVID-19. The devastating immunological and inflammatory cascading factors caused by COVID-19 did not allow us to say goodbye to loved ones who died who did not have COVID-19. These were all human beings with families, and not just a number created by a dashboard. We should not become numb or desensitized to tremendous loss of life from COVID-19. With all due respect, condolences to all who died and to their families for the loved ones who have transitioned. This next part of the presentation, I am primarily going to be referring and using the guidelines from the Centers for Disease Control, CDC. Prior to discussing all the trauma and impact COVID-19 has caused the Black community, I would like to go over one case which has a disease process to it, so that if anyone out here, anyone, will be able to recognize, okay, what does this mean when it says 2 to 14 days? And what does this mean when it says fever? And what does it mean when it says quarantine for 10 days and so forth? We should all be able to recognize this. So I'm going to talk about patient 47. Patient 47 was diagnosed with COVID-19 on October 1st. This patient had a fever, he had difficulty breathing, he had some problems with his oxygen saturation falling. Normally we like the oxygen saturation to be between 96 and 100%. So this patient had less than that. So by the CDC guidelines, it says that a person who's infected should feel sick anywhere between 2 to 14 days. There are two types of patients that we have with COVID. We have the ones that are pre-symptomatic, which shows symptoms, and we have the other patient who is asymptomatic, who don't show symptoms. Well, this patient was pre-symptomatic. According to information we received, this patient only had one fever. We're not sure if he didn't have any other fevers, or if the fevers were masked with, say, Tylenol or ibuprofen. But this person had one fever, started on October 1st. So if we look at, say, going to October, the 10 days, there's a 10-day guideline that they're supposed to quarantine. Then by the addition, this person should be done with all of their symptoms, not their symptoms, but this person should not be infectious by October 11th. Now, again, we did not know all of the symptoms, or we may not have been told all what was going on with this patient. But supposedly by October 11th, patient 47 was not infectious and could go out into the public. I just wanted to, because we all have to take care of ourselves, I just wanted to give another example. And instead of using that, just make sure that we all understand that, for instance, this is October 15th. If patient X had a fever on October 15th, then 3 days later, if this patient no longer had a fever on October 15th, then we look at the 10 days. The 10 days out would be October 25th, and this patient should no longer be infectious. So a couple of things that I just like to, and I know I'm not part of actually the toolkit, but I like to show that we should all have our thermometer. I'm not sure if it's, okay, our thermometer. And I like to have a pulse oximeter. I like to keep a pulse oximeter because with COVID, it really is important. And I also have my family members have it. It really is important to check our oxygen levels at times because COVID is asymptomatic. And so we want to make sure that our oxygen levels are above 95%. So before moving on, I am about to talk about the trauma and mental health effects which COVID does cause. And I want to also signal that this can be a timeout for some people because what I'm about to talk about may be traumatizing. I wouldn't want to wake up anybody's trauma, and we all want to have good and positive dreams tonight, but I am about to talk about the trauma in the Black community and with COVID. So what does all of this above have to do with mental illness? And how does COVID-19 affect Black people? Trauma, trauma, trauma. Trauma and stressor-related disorders. So I go to DSM-5. DSM-5 is analogous to the Encyclopedia for Diagnosing Psychiatric and Mental Illness. DSM-5, which is the diagnostic criteria for post-traumatic stress disorder, give about 4 criteria. 1, if a person is directly affected by the trauma. 2, if a person witnesses the trauma. 3, if the person has learned about the trauma from a family member. The 4th is experiencing repeated or extreme exposure to adverse details of the traumatic details or events. Now, DSM-5 said, note, this does not apply to exposure through electronic media, television, movies, or pictures, unless this exposure is work-related. So I understand why PTSD does not apply to exposure through electronic media, television, movies, or pictures. But let's just think about it. Is that true for Black people? So I asked the question, is PTSD or is it neither when Black people are dying from COVID-19 at higher rates than any other race? So many of us had no choice but to witness and funeralize Black people dying through television, social media, because of COVID-19. Is it PTSD or is it neither? And when I go back to saying neither, the way the DSM-5 characterized neither is that we can't see it on television or we can't witness it through electronic media. Is it PTSD or is it neither? When Black people with COVID-19 don't have access to health care, or when the hospital have to make the decision as to who life will be saved and who life dies. Thirdly, is it PTSD or neither? When Black people must march during COVID-19 pandemic for all the police brutality, and many of us watched it on television or social media. Well, the CDC calls this toxic stress. Black people are continuously going through toxic stress due to racism or discrimination. The definition of toxic stress results in the prolonged activation of the stress response, with the failure of the body to fully recover. So we have failure of the body to fully recover. So African American bodies are in a weakened position, which means it is prime for COVID-19 to enter. Unfortunately, in our Black community, we have a lot of toxic stress, and we are dying from COVID-19, and the cycle continues. We all know the difference between saying someone have toxic stress versus someone having post-traumatic stress disorder. It can be related to the disability, and this can be a financial disability. Well, there's positive news. There are many, many Black doctors who are working on research, writing, speaking, so that there can be some policies changed, which should help us. So now I'm going to move on to Black women in mental health. In particular, we know that October is designated as Depression Awareness Month. When we think about depression, we know there are physiological changes, there are emotional changes, there are motivational changes, and there are behavioral changes. When going through what are some of the signs and symptoms of depression, we used to use this good old acronym that so many of us remembered in health as SIG-E-CAPS. And I'll go through each one. CS stands for sleep. We know that's physiological. Interest is I, and that's part of the motivational aspect of depression. G, that's guilt. Guilt is part of the emotional and behavioral aspect of depression. E-caps. Okay, C, I have to remember myself. Concentration. Concentration deals with motivation. And a lot of times when people are depressed, they are having difficulties with concentrating. And I'm really going to go back to the part on sleep, because right now, regardless of if it's depression, anxiety, or many other mental health issues, the sleep and the biological clock and the circadian rhythms are really, really off with so many people. So I'm going to continue through the spectrum of the acronym of depression. The next is energy. A lot of people who have depression have low energy. Okay, the next is appetite. So when talking about depression, some people can have loss of appetite, but unfortunately during COVID, while we're being shut in, a lot of people have talked about COVID-10 and COVID-15, which tends to mean that a lot of people have we're eating more and we have increase in appetite. P is pretty You see that a lot with adults. That means a slowing down effect. They call it psychomotor retardation. And last but not least, with depression, we look at and we see suicide, and we always assess for suicide when someone is depressed. When I talk about depression, there's so often the stigma, but depression is real. We know that with depression, women have depression twice as much than men when we think about and look at the epidemiology. When we think about African-American women, and we compare it to, say, white women, African-American women may have less depression than white women, but the disease process is longer than it is for white women. When I talk about the treatment of depression, then we go to two primary types of treatment. We think about cognitive behavior therapy, and also we think about medications. I wrote that I'm currently seeing so many patients who are so stressed. So many don't have any sense of hope or any despair. We know so many people who have, because of COVID, lost their jobs, have lost loved ones. And so we're looking at loss of employment, loss of health insurance, if they had health insurance. So there is just so much loss, and that just causes a lot of despair and a lot of stress in our Black community. One thing that would help in our Black community or throughout the nation is wearing masks. Primarily right now, we know that there is only less than 50%, or about 48% of people throughout the United States of America wearing masks. Black lives and all lives could be saved if the number was increased to 98%. We should all be doing our part, because not only is COVID-19 here, but shortly we're going to have the twindemic. And I don't know if everyone is aware of what the twindemic is, but we're going to have the flu and COVID-19. So that in itself should also make more people want to wear a mask. Masks will save lives. So I had one other article that I really reviewed, and it was the Texas Medical Association article, and it was this month's article, and it talked about COVID-19. And what it said was, in all honesty, that we have really 3 mental illnesses which have increased during the COVID-19. One is depression, which I have already talked about. Secondly is anxiety. And lastly is substance abuse. Because again, there's been so much loss of income, loss of family, loss of health insurance, loss of employment, that has led to an increase in all 3 of these disorders. It was mentioned by the CDC in March that substance abuse was on the rise. And that was based on people drinking more and buying more alcohol. Well, we do know with this condition that what people were doing was self-medicating. According to the research, people were not able to go out to the malls as much. They weren't able to go to the movies. So people were staying home and self-medicating with alcohol. I lastly would like to mention, what are some of these symptoms which, if someone have COVID-19, one will see based on mental illness? First, we all know about the dry cough. Second, people have a lot of anxiety. A lot of this has to do with how far along in the disease process would someone have COVID in terms of what's going on with their mental health issues. Someone may have depression, but someone who may have been on a ventilator may have panic attacks. They may have a lot of dissociation. They may have a lot of depression because they may have been in an ICU. They may have also psychotic disorders. So there have been a lot of different mental illnesses which have been involved when one receives or have this awful, awful disease of COVID-19. Also, I must say, one thing that may happen is if someone have fever, then they may tend to have more of the psychotic disorders. The fever can lead to more of the hallucinations. The fevers can lead more to someone being disoriented. And the fever can lead more to someone having disorientation or dissociation. So what are some of these self-care practices that one can have, which can help if they have problems with depression or anxiety or a lot of stress? At Johns Hopkins, we can get good rest. Aim for these 7 hours of sleep. They talk about meditation, move more, exercise, eat well, connect, schedule time with a friend. Studies show that social support improves women's mental health. Know your limits. Set boundaries, such as not checking email after a certain time. Okay, the positive resources. With the positive resources, and I know my time is almost up, we want to turn off the sympathetic nervous system. That's the fight and flight system. We want to turn off the limbic system, and we want to turn on the soothing, calming parasympathetic system. So one of the things that I definitely enjoyed on Sunday was our HAC Chaplain's Care 21 Days of Prayer Kickoff, which is telling us to meditate and read Psalm 37. I think it's a wonderful thing, and I look forward to it happening and ongoing every month because it really is needed right now. There's one thing I would want to mention, which is called the free virtual Hope Box. The free virtual Hope Box is an app by the National Center for Telehealth and Technology. So it was developed out of Washington by the Department of Defense. It really has a way of meditating, and it has some positive affirmations. And I would encourage everyone to download that app. It's very, very helpful. I think my time is almost up. I know my voice capacity wasn't the best tonight, probably seeing so many patients today, but I'll definitely enjoy and thank everyone. First of all, Madam President, Jonas Sargent, for allowing us to have this presentation. Everyone on the Health and Physical Awareness, Mental Health Committee, Program Committee, I'd like to thank everyone for participating. Thank you.
Thank you, Sarah Anna. We really did take in a lot of information today, and I know that when 8 o'clock comes, there will be a lot of different questions pertaining to how to take care of ourselves mentally and emotionally and physically during this COVID period. So now we have Dr. Anjanette Wyatt, who is a doctorate in pharmacy. He's going to give us one little real special tidbit, which is her own personal COVID kit that she's come up with, and give us different information pertaining to COVID. Thank you. Sarah Anjanette.
Good evening, Saras. How are you? I'm so happy to have everyone here today so that we can learn a little bit more about COVID-19. I want to empower you with knowledge so that you can be of service to not only your family, but also your extended family members, friends, and in other Saras in Delta. So I want to just give you some tidbits about COVID-19 that can really assist you and help you through this pandemic. Next slide. And I'm going to talk a little bit more and not go through the slides as formally. Sarah Anna has gone through quite a bit of this, so this is just talking a little bit because what I do believe is empowering everyone with knowledge. I'm not going to even go through my bio because we're pressed for time, and I'd rather you know more about the virus. Many of you may know me. I'm Dr. Anjanette White. I am a clinical pharmacist. I graduated with my undergrad in pharmacy, my bachelor's in pharmacy from Texas Southern University, and I went back for my doctorate in pharmacy from Texas Southern University. I also have a biology degree from UT Austin, and I've worked in the industry in various ways, even teaching at Texas Southern University in the College of Pharmacy. So I have a lot of history in pharmacy, but I'm going to move on to the slide so we can get through as much as we can. So this, you can look at this and it tells you a lot about the viruses in general. Many of you probably, as Dr. Anna mentioned, know that we've had outbreaks before with coronaviruses, but this one is called COVID-19 because it's just a coronavirus of 2019. So I'm going to move on to the next slide because this talks a little bit more in detail about the virus itself. But in the United States, we've had quite a few cases. This is as of yesterday. There were over 7 million total cases, and total deaths was over 215,000. And in the last 7 days, we've had this over 300,000 cases. So as you can see, this virus is very virulent and it's not going anywhere anytime soon. We all have to take the precautions to make sure that we protect ourselves and our loved ones. Next slide. I want to show you in the African American community what we're dealing with. We are 2.3 times higher to get the virus. Look at the rate of our people dying versus our counterpart Caucasian people. This is real. And I really want everyone to see that we've lost over 41,000 Black lives to COVID-19 to date. And if you can look at the numbers, you can see we're at the top of the pyramid here when it comes to deaths per 100,000 people in our community. And we really, really want to home in on how can we help save lives? Each of us can help save lives. Everybody needs to know as much as they can about this virus so they can help in the process. Next slide. So sorry, Anna talked a little bit about transmission, but I do want to say that this is a human-to-human transmission. The SARS and the MERS that came out that were out before, they were from animals. This is really not from animals. This did not take a zootic jump from a bat or a monkey or anything. It is human to human, and so the thing that we can tell our people is that it lives up to 9 days on glass surfaces or on plastic. And on average, it can live even between 4 to 5 days, or it can survive. So that's why it's important that we clean our surfaces, our door handles, everything around us that is a surface that the virus can adhere to. Then we need to make sure we clean that. And of course, you know, with the alcohol and all of the different products, they're listed right here that are effective in making sure that virus is killed during the process of cleaning. Next slide. So I want to talk to you so you can know more about the virus. The virus causes coagulation in the body, and you know that's clotting. So when you have an injury to the human tissue, the process of inflammation is activated. Like if you cut yourself, then you'll see, you know, the process of coagulation occurring in inflammation. The body wants to stop the injury and limit it to that one spot. Okay, so what it'll cause is clotting and vasospasm, narrowing of the blood vessels to stop it. So COVID-19 is a viral infection which activates the inflammatory process. So you'll see a lot of massive amounts of inflammation in the body. And I know you guys don't know, you probably are not aware of cytokines and all that, but it causes this storm to happen in the body, which a lot of times doctors can't keep up with the storm. The storm is raging through the body and the doctors can't keep up with it. So what we want to do is prevent this process from even happening. Next slide. So let's talk about how we can, one of the ways that they're looking at to try to circumvent the virus, and one is called monoclonal antibodies. And at the beginning of the virus, the pandemic, they were looking for people who had already had the virus and they had already had COVID-19. They built up antibodies, so they wanted to take those antibodies and place it in another patient so that they could be covered with antibodies to the COVID-19. The antibodies last approximately 3 months of the coverage. And this can also happen in people after they are vaccinated. They build up antibodies. Once a person is exposed to the virus, they already have the antibodies. So they were trying to slow the process by transferring the antibodies from one person who had it to another person. Next slide. So what I want everybody to know is what are the treatment options, because a lot of times the learning curve, all the physicians, all the medical profession, everybody's working feverishly to get up on the learning curve. But if you are empowered with a little bit of knowledge and you can go in knowing what is working and what is not working, then you can go in with your loved one and be a patient advocate for your loved one. So let's talk about what happens. So you have the inflammatory process being elicited by the virus. So long before this came out, just thinking on a pharmacological level, I thought, why aren't they giving patient dexamethasone? Well, dexamethasone is a corticosteroid. I couldn't figure out why they weren't giving the patients this, because if the immune response is elicited, just like in an autoimmune situation or whatever, if you have an immune response eliciting inflammation occurring, typically dexamethasone is utilized. So with that, dexamethasone has proven to be a great medication. That is what our president was given, dexamethasone, which really stops the immune and slows down the immune process in the body. The other medicine that is really has shown really good promise is remdesivir. And I put the names up here so you guys can jot them down, so that if you have a loved one that's in the hospital or ending up in a worsened state with COVID, that you will know the names of these drugs and you can ask their physician or your physician about them. But it inhibits the DNA chain formation and shortens the recovery time of a hospitalized patient with COVID-19 and with lower respiratory tract infection. So you want to ask about this. If your loved one isn't being given this, then ask about it. I thought also, prior to it coming out, I thought this could have some parasitic type of, history or background to it. I really was thinking an anti-parasitic would work. And then they came out with the ivermectin, which is an anti-parasitic drug that's believed to kill the virus by decreasing the energy and inhibiting the electron transport system. So if you have a parasite that's ravishing and moving through your body, anti-parasitics kill and slow down that parasite. So this is the same thing that it does to the virus. The other one you heard a lot about is hydroxychloroquine, which we heard over and over and over in the news. And the use of it is debatable. It could depend on timing. So if the patient is not in the hospital, then this is not a good drug to give. They were just giving it to everybody. I mean, even pharmacies were stocking up on it to see that if the doctors were going to start prescribing it, and they did. They prescribed quite a bit of this medication, but it's very debatable. It can change the pH of the environment and make it more basic. We'll talk a little bit more about the pH of the body and it being basic or acidic in a few minutes, but it is good because it changes the pH of the body. And the coronavirus is known to thrive in an acidic medium. A lot of people got Z-Pak. I know you guys know that the azithromycin, which is a Z-Pak, and that's because those who were not in the hospital, it was believed that the coronavirus was coupled with a bacterial infection. And so it was superimposed on that the viral infection. So a lot of doctors prescribe the Z-Pak in addition to zinc and some other products. But be careful, because azithromycin is a macrolide antibiotic, and if you use that with hydrochloroquine, then they can't be used together, because it may cause a myocardial infarction, which is a heart attack. Okay, next slide. So everybody kind of be cognizant of these drugs if you have a loved one that's in the hospital and not getting any better with COVID. So let's talk about OTC products, and this is where the toolkit comes in. So I know you heard a lot about zinc. Zinc boosts the immune system, and it can cause a change of the cell membrane, so that the host cell becomes more permeable. The vitamin D you heard about, it decreases the affinity that the H2 receptor, a receptor is what binds and make that virus go into the host cell, and it decreases the affinity for the H2 receptor, which is the receptor that the spikes on the COVID cell binds to. Vitamin C and echinacea, they're both immune system boosters. So why do you want to boost the immune system? Because again, when you get COVID, it elicits the immune response, the inflammatory process. So you want to have the vitamin C and the echinacea to boost your immune system. The aspirin can decrease clotting. And again, that's what happens with the vasoconstriction and the clot formation, the thrombin formation that I talked about earlier. And then alkaline, you want to keep the body more pH, higher pH. So alkaline water is good. Now, don't take ibuprofen though. Ibuprofen is a propionic acid derivative. And if you remember, we said that the virus loves an acidic derivative. In fact, in Italy, they were giving all of the patients ibuprofen, and the patients were getting worse, and they couldn't figure out why. And it was because ibuprofen is a propionic acid derivative, making the body more acidic. Next slide. So this is my little toolkit that I put together that I want everybody to know that this is what I do. This is what I take. Before you take anything, always consult your physician and talk to your physician, because over-the-counter medications can interact with medications that you take that are prescribed. So what you want to do is talk to your doctor about it. But I have some things here, and I have it on there. I take my vitamin D every day because it plays a critical role in the immune system. So it could have a protective and therapeutic effect. Because it has an antimicrobial effect. It also helps with that affinity to the H2 receptor that the COVID structure has. And it also is protective of the lungs. So get your vitamin D for your kit. The next is zinc. I don't have my zinc here, but it's key in maintaining a healthy immune system. So you want to keep that immune system very healthy. It's an essential micronutrient involved in the regulation of the immune process, and it plays a role in inflammation. Zinc deficiency in the body, it elevates the response and damage to the host. So we want to make sure, and the host is you, by the way. So we want to make sure that we keep our zinc for our immune system as well. Next slide. So those two in the kit. So what else do you need in the kit? You need your vitamin C. I have my vitamin C. I take it every day. And through the winter months, echinacea you can't take ongoing for a long time. But during the flu season, I would keep a bottle of echinacea because it's also an immune booster, and it's the root of C. So it's really help that immune system build up. And they also have anti-inflammatory properties. So you also want to keep those because of the anti-inflammatory properties. So as you notice, most of these have anti-inflammatory properties as well as being immune boosters. Now for daily aspirin, a lot of people are on daily low dose aspirin, but before you start taking any kind of blood thinner or aspirin, you always again should consult your doctor before you start to take any type of any type of aspirin because of bleeding complications that could occur. So, or you may have aspirin allergies, which can also include asthma to aspirin. So, I mean, asthma. So the other thing is a bleeding ulcer in the stomach. You don't want to cause a gastric bleed or anything like that. Other than that, again, COVID causes clotting. It causes elicit the thrombin process. And so where's my aspirin? Okay, I have my aspirin that I take every day to make sure to keep the body, the blood flowing freely in the body. Next slide. Okay, so alkaline water. You can get this at the 99-cent store. I don't know if you guys ever go there, but they're very inexpensive, alkaline water. So what we know is that COVID thrives in an acidic environment. So you want to make sure that the pH of your body is more basic than, or more alkaline, which is basic, than acidic. So regular drinking water has a pH of about 7, whereas an alkaline water has a pH of about 8 or 9. There's a study that was done on athletes and just, people who are exercising, and it showed that the blood viscosity, the whole blood viscosity was shown to be better, and the blood flowed freely with drinking alkaline water in the rehydration phase after exercise. So with that, it just shows that alkaline water is better for the blood viscosity and having it move freely. You want your blood to move freely through your body. Some people, and I haven't done this one yet, I do drink the alkaline water, but I haven't tested my pH. Some people say, oh, you could, just go get the keto sticks and test or go get the sticks and test your pH of your urine or whatever. But I haven't done that at all. But I do know that keeping the body more alkaline, which is what normally is recommended for the body in terms of pH, is better. Let's see. And then the last one is a product. I don't know if you guys go to Sunshine, but this is sold. I sell it at my store, and it's Sunshine. It's called Gingardum. It is a liquid. And you can see this liquid called, let's put it up here. Yeah. I do have it here, and it's a mixture of ginger, garlic, and turmeric. And as you know, all three are great, great, great products for the body, and it restores and activates the body natural repair system. So it's all natural. There's nothing unnatural about the product, and it also has anti-inflammatory process. So it comes with a shot glass right here, and all you do is take a shot in the morning and a shot in the evening, and you will feel like $1,000,000 because your body is really getting rid of toxins, and it's making sure that the inflammatory process is not, or your inflammation is reduced in your body. All of these products is what is good in a toolkit for you to kind of prophylactically keep your body in a state that the virus does not like. So the virus does not like a basic body. It does not like the blood flowing, because it will clot and make the blood clot. So this is my toolkit. So I have at least 5 or 6 items that I do every day that I recommend to patients to have and to do. So next slide. So let's talk about the vaccines. Everybody's a little bit apprehensive about the vaccines, but I do want to say that our community has been hit the hardest with COVID-19. So not to tell everyone to rush out there and get the vaccine, but I was a part of an initiative, a national initiative, and it's with NEHI, I'm sorry, and it was for the infrastructure. So there's a lot going on that I think you guys need to take a look at what's going on nationally. There are 5 states identified for a pilot program on how this vaccine will be rolled out to the community. And that's very important for our African-American leaders, those of you who are in politics, to know that there's a process of rolling this out, and we need to be at the forefront. Our leaders need to be at the forefront of how this vaccine is going to be administered in the African-American community, because we're hit so hard. They only have so many doses that will be available. And so earmarking those doses for your underserved communities is very important. Also, access, that's another issue. Having either not having insurance or anything like that, we want to make sure those doses that the government is giving out are earmarked for our community. So I don't know if you guys heard of the Operation Warp Speed, but these vaccines are being pushed through a little bit faster than a normal vaccine would go through. So that's why everyone, there's a lot of trials going on. They are encouraging African-American participants in the trials so they can study these vaccines as quickly as possible to get them to market. But our government has initiated Operation Warp Speed, which means they are going through so much faster. There are a plethora of different biopharmaceutical companies that are developing candidates for COVID-19, vaccine candidates for COVID-19. More than 18 biopharmaceutical companies are developing and trying to get their product to market. I worked with Eli Lilly and Company for almost 10 years, about 8 years or so. And, I'm very, very familiarized with how drugs come to market. And typically there's a long process in making sure that the drugs are safe and before they come to market. But because of the severity of the pandemic and because we want to get these vaccines on the market as quickly as possible, there's been an accelerated process. The government has chosen 3 of the vaccine candidates to fund for the trial operation, and that's the Moderna and the AstraZeneca product, AZD1222, and the Pfizer and BioNTech product, BNT162. These are, most of all of them, when I looked them up, were in phase 3 testing right now. The next slide. There was a product, another product that was out, that came out of Russia, but that one didn't show promise. It was a really, really controversial, and it caused a lot of side effects and a lot of adverse effects. So that one was not supported and was stopped. But these 3 are showing promise, and I do not think that we will have anything out by January, but I think more like closer to the summer will be what we're looking at. What I do want to say that know your medications that are efficacious. Again, dexamethasone, people are walking out of the hospital once they're given dexamethasone, and they were not giving everyone dexamethasone at the beginning. Again, our president did receive dexamethasone. He did walk out of the hospital. So these are things that you need to know for your loved ones. I think that the more we know about the virus, the more we can protect our loved ones, the more we can protect ourselves. Again, wearing the mask and doing all the taking all the precautionary measures is very important in circumventing the virus in, spreading from one person to another. But again, if you keep your toolkit, keep your kit, your COVID kit, and you do what you can and make sure your loved ones are doing what they can, especially your elderly loved ones. And I think that we can really make inroads into decreasing the deaths in our community. So that's it for my presentation. And we are 4 minutes to 8.
All right. Thank you, Dr. Wyatt. Okay, so this is where we're going to be opening the floor up for questioning. So I think I'll start off with the first question so we can kind of give people thought about what they want to think about, ask. Okay, so one of the major things people say you drink to build up your electrolytes after you exercise is Gatorade. What's the difference between the Gatorade and alkaline water, and which one will be more beneficial? Dr. Viltz, I hear you laugh.
You want me to?
I'll let Dr. Wyatt talk about it.
Oh, well, the Gatorade, number one, there's a lot of sugar in Gatorade, number one. So you want to stay away from Gatorade if you're not exercising. Number two, there are electrolytes in Gatorade for rehydration.
Okay.
So with the alkaline water rehydrates, but it's doing a different thing, which is it's a higher pH, and you want your body to have a higher pH because the virus hates that. It does not thrive in a body that would have a higher pH than one that was very acidic. Number one, alcohol is dehydrating. So we definitely want to tell our loved ones not to drink a lot of alcohol because it's going to cause dehydration. So, you know, when you rehydrate, it has been studied, and I referenced a study that shows rehydration with alkaline water is really optimal. When you're rehydrating with Gatorade, it's because you're losing electrolytes due to sweating or exercise or something of that nature. So if you're not exercising and you just, you know, then it's better to rehydrate with water or with alkaline water.
And I totally agree. Also, just to add on, things that make also caffeine products also dehydrate you. When you're drinking lots of coffee and lots of caffeinated products, that also, you're gonna lose your water. So just to tag on.
Okay. Okay, so we have a question from Karen Prince. Go ahead and ask your question, Karen.
Okay, I was asking, what is the latest on the research regarding blood types and the effect that the virus has on various blood types? Because there was some, you know, information out there regarding type O versus type A. Are there any updates regarding that?
So I did hear and exactly what you're saying, if you're type O or type A, but I don't know of any updates on that. I don't.
I don't either. I'm not seeing any updates on blood typing. I think that was something that they thought about and looked at the beginning. And, you know, they were saying that, you know, different blood type was more likely to contract the virus and all that. And I haven't seen any additional information out there about that. I think they've shifted, you know, away from that as much. But I tell you what, if I find out any additional information, I will let Chair Trina and Chair LaTrinda know to get back with you on that information if there's anything that comes up in the near future.
Mm-hmm. Right.
Thank you. That was a very interesting question because I have a guy, as a matter of fact, my supervisor, he will not wear a mask. He won't do any preventative measures because he says that he's type O and that he is not prone to being a carrier of the disease because of his blood type. So I'm glad you brought that up so I can go back and tell him no. We have another question. Sarah LaTrinda Moore would like to ask a question.
Question, how am I to distinguish COVID symptoms versus flu symptoms? Because we're coming into flu season. So every time I get a cough or sneeze, I'm quick to be like, oh my God, is this COVID? So how do I distinguish between the two of those?
Oh, that is an excellent question. And they're both viruses, and it's going to be quite difficult. I think, unfortunately, when you have your fever, you're probably gonna have to have tests and probably gonna have to take the PCR and find out if you have the COVID versus if you have the flu, because it can be very, very difficult and very, very challenging. Because we know there can be fevers with both, there can be coughs with both. So I think I
would like to add to what Dr. Anna is saying. You will have to go in and get tested, but I would like to encourage everyone to encourage their loved ones, everyone in the community, to get your immunizations this year. It is so important to actually get our flu shot.
Yes.
And get the elderly. The elderly needs their pneumonia shot. So this year, if not any other year, please encourage your loved ones to get their flu shot, get their pneumonia shot, and keep up with their vaccinations, because it's going to be really important this year in particular with what did you call it, Dr.
The twindemic. It's now called the twindemic now. We have COVID-19 and the flu. But you're absolutely right.
It's flu.
Yes.
Okay, so
but that's an excellent question.
Right. And remember, the flu is deadly as well.
Yes.
So it's not just COVID. The flu actually is responsible for a lot of deaths, quite a few deaths in America, more than you can imagine. So please, with that pandemic, with that, the flu and the pandemic, we need to make sure, because the COVID vaccine is not available yet, that everyone have those shots.
And wear masks also. It's so important if everyone is wearing their mask, if you can, well, I don't know, how do you talk to certain people who don't believe in wearing a mask, but stay away, I guess.
Okay, so we have another question. Our immediate past president, Sarah Tina Marie Green Jones. Can you go ahead, Sarah?
Thank you so much. And to both of you, this has been phenomenal, very empowering, and great information that we all can use. But let me ask you, is it true to the fact those that are with the COVID, for them to lay on their stomach? I know that's been something that has been talked about a lot. I had a brother-in-law recently to pass from COVID, and the very unusual thing to us is he was doing so well at one while. They got him off the ventilator. We were interacting with him, and all of a sudden we got a call that he had turned, and he was back on the ventilator, and within a day and a half he passed. And so that just kind of threw the family off of rhythm, because, you know, we were getting feedback from people in the community, tell him to lay him on his stomach, tell him to give him this, tell him to give him that, and we were just all crazy. And I'm sure you know, Dr. Biltz, how chilling it was for us to have to visit him at the window.
Oh, yeah. Oh, yes.
I will never forget what that was like, to have to look at him laying in a bed, and we're on a Zoom interacting with the nurses to be able to speak to him. So is that a myth about this stomach stuff, and
No.
all of that, or give us some insight? Thank you.
All of us, again, probably have lost family members, friends from COVID. So early on, when patients were going in the hospital, there was an old medical technique that people thought about: place them on a prone, place them on their stomach, because it's going to help with oxygenation and it's going to help with the breathing. So I'm not sure if I can go into additional further depth as to why, but yes, early on, yes, patients should be placed on, or people should be on their stomach. It's going to help their breathing.
Okay, that's
respiration.
Okay, so we do have another question.
Also heard.
Go ahead. I'm sorry. Go ahead.
Sorry, no, I was just piggybacking on what Dr. Anna said. I heard the same thing in terms of the oxygenation and getting oxygen through. One of the things that happens with the COVID, it invades and causes all the destruction in the lungs and the alveolus of the lungs, so that a lot of times the doctors were seeing that the blood is oozing through the lung tissue. So that's why it's very important once you get to that stage. And I'm so sorry for your loss. Sorry, Tina Marie. It's very hard, and I understand. It's very, very hard for your loss.
Yes.
Yes. Okay, so we have another question on board. Sarah Rosalind Baker. Sonia Baker. I'm sorry, Sarah.
That's okay. Can you hear me?
Yes.
So I have two questions. One is, what is herd immunity, and can you get COVID again?
I'll take that. Were you about to talk, Dr.
Go ahead, because we both know what it is. But
yeah, herd immunity
is
when everybody has pretty much gotten the virus and have antibodies in their body against the virus. And that's called herd immunity. Everybody has really contracted it, and they already have the antibodies to fight it off. When the body sees it again, it knows what it is. you know, it has memory. And so that's what herd immunity is. We haven't achieved herd immunity yet with COVID-19. We're nowhere near herd immunity with COVID-19. We have a long way to go, and a lot of lives will be lost.
That's right.
Trying, you know, getting there. A lot of lives will be lost getting there. And so we want to make sure we minimize, especially in the African American community, the number of lives we lose as we get to herd immunity. And Dr. Anna, you can add.
Absolutely correct. Especially with Black lives and Black people we're dying so much more, and we have that susceptibility. I know I read the paper from sociologists, and I know you would know with the ACE and renin, and they talk about the cytokine storm and how it's really affecting us in African American community. I know that's real medical stuff. But I know there was that second question when she asked, can people get COVID a second time? I'm not sure we actually know the answer of that. There are a few people that you hear may have had it, and so there's been some inconsistencies. That means, well, where they fully, did they fully get past the disease phase? That's one of the questions that someone was saying. When I think it was in Taiwan where someone had they said, oh, they have the disease again. And we're like, well, were they really clear?
And I'd like to add to that, there are 4 different strains of the virus. So what I believe is occurring is they may have one strain and then they get over that strain and then you're reinfected with a different strain of the virus. Just like the flu has different strains, so will COVID-19. What I've found in my research that there have been 4 different strains identified.
Wow, see, I didn't know that. Now, I did hear that Houston has one of the most but one of the most virulent strands. Unfortunately, we do. I heard it may not be the most deadly, but it's very much out there and it's going to cause a lot of problems. A lot of spread.
So I wanted to add a few things to my toolkit that I want to let you guys know, because I'm always on the lookout for things to help. And I would encourage you guys to wear your gloves when you go out because of the surfaces that you touch. I know a lot of people don't like the way the gloves look, but I'm telling you, I have ordered on Amazon red gloves, purple gloves, every black glove, white gloves, because you can really look stylish with your gloves. You just don't want your hands touching the surfaces, because you can then touch your face, your nose, and this is how the virus enters the body. Also, I wanted to say, you know, we all have our Delta mask and our cute little mask. A lot of times what I do is put the surgical mask underneath the mask, the cloth one that you buy, because every mask that you get isn't as effective against the virus as the actual surgical mask. So I put one underneath and then put the stylish one on top. Another little tidbit. Right now, Sam's have these out. I'm just trying to share everything, because you can't find this in big bottles like this. And they're only going to be out there for a limited time. So these are so handy. I spray everything down, and they also have the large hand sanitizers, and they're not overpriced. So I just want to share this with you guys, because when I go out, I know people think I may be a little bit paranoid, but I'm not. I know you guys don't want COVID, and you can hear the stories of losing loved ones. And I have an 80-year-old mother that lives with me that's immunocompromised, and I just have to be very, very cautious of going out in the community and out to work and coming back in. So I'm very cautious. So I just want to tell you these guys were available at Saints.
Okay. We have another question, Sarah, President.
Good evening, and thank you so much for the information. I have a couple of questions about tools. I've been drinking alkaline water for quite some time, and I kind of migrate towards the 9.5 and up, but also occasionally drink the hydrogen water. I want you to give me your thoughts on that. And I've also been taking elderberry. I take it sometime in the liquid and the pill. So I just want your thoughts. Everything you've mentioned tonight, I have in my toolkit, with the exception of the one that starts with the E. And believe it or not, but I just wanted your thoughts on the difference between the alkaline water, the high pH, and the hydrogen, and whether or not, you know, one better than the other or what.
I believe, I don't know as much about the hydrogen water, to be honest with you, but I think hydrogen water is going to add, because when you look at the molecule, the hydrogen molecule, you know, it's going to add more to, I think, oxidation. Now you can, Dr. Anna, if you, because I don't know as much about the hydrogen.
I don't know as much either about the hydrogen water.
Okay. And the elderberry, what's your thought?
Elderberry is very, very good. I mean, I ordered it and I haven't started taking it yet, Madam President, but that's the next one in my toolkit that I will start taking. I think it's a great substance that you're doing a right thing of having that in your toolkit. And I'm going to add it to mine tonight or tomorrow.
Thank you.
Okay, I have another question. I want to know, what, Dr. White, did you get from 1 or 2 points from your summit that you did, the network of health innovations? What were some of the key points? I need at least 2 that take home points for the Soros.
Okay. You may not like what I have to say, but I think that America is not ready. That's one take home that I got. We're not ready. We're not prepared. We're ill prepared for what's coming down the pipeline when it comes to, really, we won't reach herd immunity. So we have to immunize everyone in the nation. Think about it. That's a lot of people that have to get this virus. And then when we look at to see how many doses, we're not going to have enough doses to immunize everyone in America. So then what do we need to do? We need to make sure doses are earmarked for the African-American community, because we are at the top of the pyramid of deaths. And we will be dying at a higher rate than our counterparts. So we need those vaccinations. Again, when you look at the mental health, we may be consuming alcohol more, which is going to make our bodies more vulnerable to getting the COVID-19. So I was really intrigued because we had a lot of high top leaders on the line when I participated as a panelist. So the CEO and head person of CVS, all of the different partners, these are partners on the infrastructure that's being rolled out. Now, granted, government has us in a pilot situation with 5 states. Texas is not one of the states. Yet we are the second highest state in America when it comes to cases and deaths, second highest to California. California is a pilot state. Texas is not, and that worries me, and it really concerns me. So those are the 2 things I got out of it, that, you know, every community leader needs to get on board in trying to make sure we are a part of the conversation as to where these vaccines are going to land and where they're going to hit, because all the communities are going to be at the forefront of saying, our community needs this, our community needs this, but they're only going to be so many doses that are available. I am, you know, I think this is, for me, a calling from God to get involved in what's going on with my community when it comes to access to vaccine.
So Sarah Wyatt, I just want to ask, because we know from when I was doing some research, when you go to the Tuskegee and you go to things where there was a syphilis and so much going on there, that there's going to be some Black people who are going to say, I'm not going to take this vaccination. What type of educational push? How are we going to help our Black people know that this is safe and this is the right thing to do? That's what I'm wondering.
Interesting.
The first thing we need to do is make sure African Americans are included in the studies, the phase 3 trials that are going on right now. We need African American participants in the study, which is, you know, again, why I'm a director with DREF, and we have the all of us program to try to get more African American to participate in the study so that we can see how it affects African Americans, because we are different. Our bodies absorb medications different. You know, we have the Asian community who are fast acetylators. We have the African American community who are slow acetylators. That makes a difference in how drugs are absorbed and how vaccines react in the body. But we won't know how they react if we're not a part of the study. We won't know how they react in our bodies as African Americans. So the first thing is we need to get involved in the studies. The second thing is we need to dispel the myths. People are afraid, and they have the right to be afraid of history in America. But at the same time, they should be more afraid of how many lives we will lose without the vaccine being administered in large numbers to African American, the African American community. So it is our job to educate us. And there are going to be grants. We have to really watch the money, because there's billions of dollars earmarked for this, but they're not going into the African American community for education. We need to educate our community on how bad it is, because in our community, a lot of African Americans don't even realize how bad it is in the community. But I know for myself, I have had at least 6 friends to pass away with COVID. I've had, I've been to a funeral today, even though it wasn't COVID. The stress of COVID is also a problem, an issue. And so even if it's not COVID death, it's a COVID related death, because, you know, as a result of something else, dealing with COVID in other patients, in the hospital or whatever, this death has occurred. Basically, we're in one of the fight of our lives for our African American community with Black Lives Matter and everything going on. This is another you know, issue that we really need to put on the forefront of our agenda. And
I just want to also add that right now, October, November, when the flu is coming in, it's going to really we're going to really be in big trouble with both of them happening. And I don't know, people really know that they have to have their flu shot, exactly what you said. They have to mask up and really be prepared.
We have another question, Sarah. Go ahead, I'm sorry. Go ahead, Sarah White.
I just wanted to also remind everybody that we need immunization locations. So that's another thing. We need to already, that infrastructure needs to be put in place for where will our people go to get immunized. Where will they go?
Good point.
And it should be at the churches where we know we can really make an impact on the immunization rates.
We have
and
time.
at the community pharmacies.
Go ahead.
So,
I'm done.
Go ahead. Sorry, Latrenda.
The other question that I have is that I'm someone that has taken 4 COVID tests because of work, and I thought I was about to die when I took the first test. I felt like the swab went all the way up to my brain. Tell me the difference between, I think there are 3 different tests. What exactly makes one test maybe more accurate than the other?
I think the testing is more about the time that it takes to get the results than the accuracy. I haven't seen any difference in the accuracy. I haven't seen any data that says there's a difference. Unless Dr. Anna, maybe you've seen any, but it's just a rapid results. They're improving on the results. I mean, the time that it takes, the lag time, because what we're seeing is you may test negative this day, and then they say, okay, you're negative, and 2-3 days later you're really positive and you don't know it, and then you're spreading the the virus to loved ones and you're unaware. So the rapid testing is really, really essential to slowing down the spread of the virus.
Right, and then of course, some people are getting the antibody test to see if they have antibodies instead of just taking, right, the rapid testing for the antigen. Some people are also checking for the antibodies also. So that is another difference too.
All right. So this has been a very interesting and very informative panel that we've had today. And I really want to thank the panelists for coming out and giving us this information because we need it, especially soror to soror. We are mothers, we are daughters, we are grandmothers, great-grandmothers, we're sisters. We're the leaders of our communities, and we are the ones who step out and make certain that our names, our causes, and our needs are being met. And I really do appreciate it. I also want to thank soror President for allowing us to come in and have this forum to speak to one another on Delta Care about Corona and mental health. I also want to thank preciously the tech team.
Yes.
And saved the day.
Yes.
And I wanted to Sarah Tanja and Sarah Linda.
Yes.
Thank you so much.
Yes.
I bow down to your tech committee.
Yes.
You have saved the day and my reputation. But I really want Sarah Wyatt to come out with a small brochure instead of her giving us out her entire PowerPoint, to come up with a small brochure so the physical and mental health committee can put it online and make it available for the sorors. Because it's like today, we found out through soror president that the elderberry will be excellent to add to your toolbox. So we need that toolbox in a brochure. Thank you, Soror Tracy. So are there any more questions or comments before we leave? Anybody? I want to say something. Sarah Kimberly Wright, thank you for coming to our meeting. Yeah. That is Sarah Anna's line sister.
Yeah. Hey. Yes. Our Sarah President wants to make a comment.
Go ahead, Sarah President.
You're still muted.
Oh.
I'm just talking away. So first and foremost, I want to thank Sarah's Anna Bill and Sarah Anjanette Wyatt and the HAC Wellness team. This information has been just awesome. At a time like this, we need to gather and collect as much information as possible so that we can prepare ourselves, so that we can build our toolkits. And if we keep doing what we're doing today, our community will be a better community. And then we can go, we need to take what we've learned tonight, spread and share with family members. So I'm looking forward to the little toolkit with the additional information, because I had everything she mentioned in the toolkit except for one item, and I'm going to get it. So thank you very, very, very much. God bless each and every one.
Thank you. And I know that we did not start this meeting with prayer, but we're going to ask Sarah Vilks to take us out on a small prayer.
Okay, if we all bow our heads. Heavenly Father, thank you for allowing us to give us the time and say the words that we needed to say and express and talk about the toolkit, share the education that we know that we have, and continue to be a healing factor for us. I really understand and enjoy the 21-day meditation. We need to continue praying and doing that meditation and reading Psalms 37. And through your name, we just want you to just continue to watch over us, guide us, and bless us. Through Jesus' holy name, amen.
Amen.
And with
Have a
that,
good evening, Sora. Stay safe.
all right. I know we're not traveling, but I give everybody traveling grace. Bye-bye, Sarah.
Jeanette,
Bye-bye.
and
So
Jeanette,
much.
and Jeanette, were we at the same funeral?
Yes, I was there all
Oh,
day.
wow.
Your sister sang. She was
Yeah, I had to go back to work though. I left.